For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.
Okay, it looks like we have everybody, so let's get started. So quickly, I will introduce all of our panelists today, and then each of them will give brief opening statements. We will then use the remaining time to take questions and answers. If you have a specific county or health officer that you would like to have address your question, please put that in the Q&A with your question. Otherwise, I'll do the best I can and they'll do the best they can to sort of pick and choose what questions they answer. But if there's somebody in particular that you'd like to hear from, we're happy to accommodate that. If the question seems appropriate, we might do some roundtables and have each of the counties address. It's a big panel today, so that it takes a little more time to do that. So just help us out by letting us know if there's somebody in particular you would like to have answer your question. So our esteemed panel today is made up of Dr. Chris Farnetano, who is the health officer for Contra Costa County, Dr. Sundari Mace, who is the County of Sonoma health officer. We have Dr. Namina Baba, who is the City and County of San Francisco Department of Public Health Deputy Director and also acting health officer. Dr. Lisa Hernandez, who is the health officer for the City of Berkeley. Dr. George Han, who is the County of Contra Costa, County of Santa Clara Deputy Health Officer. Dr. Lisa Santora with the County of Marin Deputy Health Officer, and Dr. Nicholas Moss, who is the health officer for the County of Alameda. I'm going to hand it off to Dr. Farnetano, who will then hand it off down the line.
Thank you, Kim. To slow the spread of this latest COVID-19 surge, the counties of Alameda, Contra Costa, Marin, San Francisco, San Mateo, Santa Clara, Sonoma, and the City of Berkeley today issued health orders mandating indoor masking for everyone, regardless of vaccination status. These health orders will take effect at midnight tonight. Across the Bay Area region, we are seeing COVID-19 cases surging, and hospitalizations are on a steep rise again, particularly among the unvaccinated. In Contra Costa County, we are alarmed at the rate at which COVID patients are filling our community hospital beds. The number of patients in local hospitals due to COVID have doubled in just the past 10 days and increased by more than 400% in the month of July. 4 out of 5 of these hospitalized COVID patients are not vaccinated, even though only 1 out of 5 Contra Costa adults is not vaccinated. We know that indoor gatherings present the highest risk for spread of COVID. While there may be slight differences between each jurisdiction's orders issued today, they all have one thing in common: a simple step, wearing a mask indoors, to provide one more layer of protection for everyone. I'd like to now turn it over to Dr. Sundari Mace, Health Officer for Sonoma County.
Great. Thank you so much, Dr. Farnetano. As was mentioned, we're taking this action today in calling for mandatory indoor masking for all residents in public settings because we're all seeing a sharp increase in COVID cases and hospitalizations in our jurisdictions, particularly among unvaccinated individuals. One thing that we want to emphasize today is that fully vaccinated residents are still far less likely to become infected and are well protected against severe illness, as well as hospitalizations and death due to the virus. In Sonoma County, our case rate for unvaccinated individuals is nearly 6 times higher than it is for our vaccinated population, even though our vaccinated population is far greater. Meanwhile, 86% of the COVID patients in our hospitals are unvaccinated individuals, and 100% of COVID patients in our intensive care units are people who had the opportunity to be vaccinated but chose not to. This is really tragic, given the widespread availability of the vaccines throughout the Bay Area. So if you've not yet received the vaccine, now is the time to do it. It's needed now more than ever. Vaccination will protect you, your family, and your community. That said, It's important that this mask mandate be for vaccinated as well as unvaccinated individuals because we're facing a much more aggressive and contagious opponent right now, known as a Delta variant. It is now widespread in our communities, making up close to 95% of the cases. This is not the same virus that we were combating last year or even a few months ago. The Delta variant is 60% more transmissible than previous versions of the COVID virus. And we're seeing an increase in the number of vaccinated people who are now testing positive. Again, vaccinated people are still protected against the most severe outcomes of the virus. And in many cases, our hospitals are not even admitting vaccinated individuals, especially if they're asymptomatic or show mild symptoms. Nonetheless, there is evidence that vaccinated people can spread the virus to others. That is why everyone must wear face coverings when in public indoor settings. I would now like to introduce Dr. Namina Baba, Deputy Director of Health at San Francisco Department of Public Health.
Thank you, Dr. Mace. So we know that with the Delta variant and in general, COVID, there's an increased risk of being exposed to the virus in indoor spaces and settings. We know that indoor spaces are where most transmission occurs, and that's why we're basing a masking requirement on an indoor space. Face coverings protect you and those around you, providing an additional layer of protection for vaccinated people too. As mentioned, vaccinated people are much less likely to get COVID, and if they get it, they're likely to have mild disease. But there continues to be a proportion of people that remain unvaccinated, and there are some that are unable to get the vaccine because that vaccine is yet to be approved for them. If you are able to choose between an indoor and an outdoor space, we recommend that you choose outdoor activities. There are people who have to work indoors though. And for that group, we want to make sure that we are protecting them. Our frontline workers have been essential during the pandemic, and they continue to be essential during this reopening period. So both for the fact that there are people out there that cannot get vaccinated because they aren't eligible, and we want to protect our workers, we are urging people to mask indoors. And that's why this requirement is happening now. I'd like to introduce Dr. Lisa Hernandez, Health Officer for the City of Berkeley.
Good afternoon, and thank you, Dr. Baba. Masks are a simple and effective tool everyone can use, but we must remember that vaccine remains our strongest protection against the Delta variant and COVID-19 disease. Vaccines strongly protect the vaccinated from severe disease, from hospitalization, and death. They also reduce chances of infection. Quite frankly, vaccines are keeping thousands out of Bay Area hospitals and morgues right now. Many more would be infected had so many residents not chosen to get vaccinated. If you are 12 and older, we urge you to get vaccinated as soon as possible. It will protect you, those around you, and help keep our region safer. I now would like to introduce Dr. George Hahn, Deputy Health Officer for Santa Clara County.
Thank you, Dr. Hernandez. We all know that by now that COVID-19 is transmitted by people through the air, and it's much more easily transmitted indoors than outdoors. And we wish we weren't in this place right now having to make this order, but what's happened is the virus has changed. The Delta variant is now the predominant variant in our area and across the country. And because it's more contagious, we need more protection, and that comes in the form of masks. That's the easiest and best tool that we have to protect ourselves and our communities. And I wanted to mention that it's really important that the virus doesn't care what kind of indoor space you're at, whether it's in a public building or someone's home. Anytime you're in an indoor space, indoor place with other people who you don't live with, there is a risk that you could get infected with the virus that causes COVID-19. And so for this reason, it is a good idea for everyone to mask up, whenever you're in an indoor area with anyone who you don't live with. What we would prefer is that you would use at least a surgical or medical grade mask, and that it would be something like this at the minimum, and you would pinch it at your nose. And if you don't have one of those, a well-fitting cloth mask would work, and certainly no neck gaiters. And no matter what kind of mask you wear, face coverings should cover the mouth and nose. And now I'd like to introduce Dr. Lisa Santora, Deputy Health Officer for Marin County.
Thank you, Dr. Hahn. It's an honor to be here today. I know it's a challenging day for many. We have sacrificed so much and worked so hard to flatten the curve, and now we're facing a new opponent, the Delta variant. The goal of these orders is to avoid disrupting our businesses' continued operations and our residents' everyday activities. Masking is a simple and effective tool to support us in this battle. And we also are all focusing on a safer return to school this fall, or for some of us in August. Delta is different. Despite our high vaccination rates, Marin County is experiencing high levels of COVID transmission. Since April, the proportion of breakthrough cases among fully vaccinated persons has doubled each month. Given increased transmissibility of the Delta variant, lower vaccine effectiveness against this mutation, and current vaccine coverage regionally, non-pharmaceutical interventions like masking are needed to reduce transmission of the Delta variant and keep our schools open this year. Vaccination is still our best tool at ending the pandemic, and when combined with masks, it provides a greater safeguard against the virus spread, and importantly, serious illness. This is a short-term, evidence-based strategy to respond to the Delta variant, while keeping our businesses open and supporting the safer reopening of schools. Thank you. And now let me introduce you to Dr. Nicholas Moss, the Health Officer for Alameda County.
Thank you, Dr. Santora. Today's announcement reflects both the California Department of Public Health and the CDC's guidance for everyone to wear a mask indoors, in public, if you're in an area of substantial or high transmission. Every county represented here today has substantial or high levels of community transmission. We must take this action to end this summer surge. Now I'll turn it back over to Kim McCall.
Thank you all. Appreciate those comments. We have a number of questions in the Q&A that we'll get to. I also want to remind you that if you'd like to raise your hand, we will call on you to ask your question in person if you prefer to do that. So I see some hands going up. Thank you very much for that. The second thing that I would let you know is that as soon as this event is over, we will make this recording available on our YouTube channel for you to download as you like. So I'm going to turn my video off so you don't have to see me answering the questions, and it will be the person asking the question and our fantastic ASL interpreter, Michael McMahon, on the screen for you. So I'm going to go away. First question, if hospitalizations increase past a certain point, do you think additional restrictions may be imposed on businesses like bars or large gatherings like Stern Grove, Giants games, or festivals? If so, what is that threshold? So Dr. Farnetano, I might pick on you first and then see who else wants to address that.
Certainly. Thank you, Kim. Last winter, our hospitals in the Bay Area were perilously close to full last winter. We saw it in other areas of the country, including Southern California, heartrending stories about hospitals being overwhelmed, ambulances waiting 6 hours or longer to offload their patients into an emergency room, patients having to be transferred far away, even to other parts of the state to find an available hospital or ICU bed, even hospitals running out of oxygen. We did not get to that point in the Bay Area, but we got really close. We don't want to get there. We are currently in Contra Costa County at less than half of our winter peak hospitalization. I'm very hopeful that with increased vaccinations, we've seen increased vaccination rates in the last few weeks with increased interest in the public in getting vaccinated. And with the addition of this masking order, that we can avoid that scenario. but we are driven by the data, and we are watching these things closely. And we want to make sure we maintain our hospital capacity, not only for taking care of COVID, for all those other things. So we will just be watching this data as we have all along on a daily basis.
Did I see somebody else who was interested in addressing that? All right, Dr. Bob, I'm going to pick on you a little bit because this question is a little specific to San Francisco. How will enforcement work specifically in San Francisco? Will the CERT team be reactivated to do compliance checks on indoor masking?
So one of the things that we know in the Bay Area is that it tends to follow the science and the data, and we're very grateful that the citizens that live here really do take these recommendations and requirements to heart. So at this time, it is going to be based on people understanding that Delta is highly transmissible, and the best way to protect themselves and their loved ones and the people around them is to wear a mask. We will not necessarily be leaning on enforcement, but again, on really the great way that the people of the Bay Area have come together to answer any issue, any things that we bring up as health needs. They've masked, they've stayed indoors as requested, and we expect the same will happen this time around too.
Thank you. I'll open this up to the group. Wondering if staff in your respective county health offices are working in the office now, or are they working from home? Dr. Mace.
Yeah, I'm happy to take that question. We still have a hybrid model where staff that are in the public-facing areas, like the lobbies, that sort of thing, are working in the office, whereas many of our staff that are able to work remotely are still doing so. And we're continuing to reevaluate that moving forward. We realize that some staff, those that are performing home visiting, for example, do need to be back in the office and working with their clients. However, we're monitoring the data closely, looking at the situation, and we'll make decisions based on that. Dr.
Hahn, would you like to respond as well?
Yes, in the county of Santa Clara, our workforce is back in the office or on their way back to the office, and our plans have not been delayed at this point of the pandemic.
Anybody else on the panel want to address any differences in their county? Okay. We have a bit of a clarifying question about does public indoor settings include share offices that are not open to the public?
Yes, it does, and that would be including places like cubicles, right? So if you had your own office with a door and everything, you may be able to take your mask off in there, but otherwise that would be considered a place that you would mask.
Dr. Santora, anything that you would add to that?
I agree. This is, I think, one of the hardest parts for some people because we have worked so hard and you often know your office mates, but at this point we are requiring that all persons who are working in the indoor settings wear a mask in that setting, regardless of their vaccination status.
Great. So the next question, does the necessity for this new mask mandate increase the possibility that the 8 health officers eventually issue a vaccine mandate of some kind? Dr. Farnitano, can I start with you again?
Yes. Here in Contra Costa County, we've already issued a order that applies to high-risk medical settings and residential settings, requiring either vaccination or weekly testing and masking for those staff. The state of California has followed up and issued a similar order that extends those included facilities to outpatient doctor's offices and dentist offices and some other facilities. We are also working with our Board of Supervisors and our local county administrator on requirements for vaccination of county employees, similar to how the state has made it a requirement for state employees. And we do encourage other private businesses as well as local municipalities to consider, vaccination requirements or vaccine or test requirements for their employees. The more people we can encourage to get vaccinated, the safer we all are.
Thank you, Dr. Farnetano. This next question, will the mask mandates end when communities reach a certain vaccination percentage? If so, what is that percentage number? Dr. Moss or Dr. Santora, thank you.
I think Marin County is an example of success in vaccination and still having a significant risk and threat because of the Delta variant. We have one of the highest rates of vaccination in the nation. We have people who have worked hard to increase that vaccination rate, and we still are seeing the need for additional supports like universal masking in order to reduce the transmission and to support businesses staying open and to keep schools open throughout this school year. So I think what we're looking more at is our hospitalization rates. And I think it's also important to recognize that Marin County is part not only of a Bay Area where it relates to hospital resources, but also the greater state of California. And so it's critical for us all to work together to maintain our hospital supply and ICU capacity in order to support the state of California as we navigate this next wave of our infection. So just to sum up, I think we're going to be looking more at our hospitalization rates and the behavior of the virus and trends in the number of cases rather than a vaccination rate that's hitting the mark.
So Dr. Santora, before you turn your camera off, maybe I'll just put you on the spot. Actually, we'll do a round robin on this one because I think it's helpful and follow up to that. Do you happen to have the percentage of current hospitalizations that are vaccinated versus unvaccinated in your county? And if each of the doctors can pull that information if you have it.
The number and the percentage changes almost daily based on hospital census, but we consistently are seeing that it's 1 out of 7 to 8 hospitalizations that are among vaccinated individuals. And those individuals are typically consistent with what we're seeing nationwide, are typically elderly with significant comorbidities. So that's our typical picture. Sadly, what we are seeing across the region and the state are preventable hospitalizations, where the majority of our hospitalizations are among unvaccinated individuals or not fully immunized individuals, and can be heartbreaking sometimes to see that someone was a week from their first dose of vaccine and landed in the hospital.
Dr. Moss, can you share the situation in Alameda County?
Sure. So we have pretty good hospitalization data in Alameda County, but it's not complete and it lags a bit. But for the data that we do have, very similar to what Marin County is reporting, the people who are in the hospital who are unvaccinated far outnumber those that are vaccinated, and we understand why this is of such interest to the public. But I think what we're seeing really supports the point that our vaccines protect against severe disease, and the best thing that people who are not vaccinated can do to protect themselves at this point is go out and get vaccinated.
Dr. Farnetano, do you want to go next?
Sure. In Contra Costa County, 4 out of 5 hospitalized COVID patients are unvaccinated. But because the population of vaccinated adults is so much greater, that really represents a hospitalization rate 16 times higher in the unvaccinated population compared to people who are vaccinated.
Dr. Hahn for Santa Clara County.
As was mentioned earlier, we are in the process of working on more exact hospitalization rates broken down by vaccinated and unvaccinated. But I can report that similar to the trends that we are seeing around the region and the nation, the vast majority of our cases that are hospitalized are in unvaccinated individuals. And the vaccinated individuals who do end up hospitalized do tend to be very elderly or with significant comorbidities.
Dr. Hernandez, what would you share from the City of Berkeley?
Hi there. I feel like I'm repeating the same message, but what we are seeing in the City of Berkeley is overwhelmingly those that are hospitalized are unvaccinated. Very few of our individuals that are hospitalized are vaccinated individuals. And as Marin mentioned, those that are hospitalized that are vaccinated have other comorbidities or are elderly.
Dr. Mace in Sonoma?
Yes, thank you. As I mentioned in my message in the beginning, about 86% of people currently, and it does change day to day, but it's always over 80% of hospitalized are in unvaccinated individuals. And we have nobody in the ICU in the past couple of weeks that's vaccinated. So all of the ICU admissions are unvaccinated. Over the course of the pandemic, we have had 330 deaths. Of that, 2 have occurred in fully vaccinated individuals, both over age 90 with significant underlying medical illnesses. And as Dr. Hahn said, everybody who's been hospitalized who's fully vaccinated has significant underlying medical conditions. So we're seeing the same thing everybody else is. And I want to also highlight what Dr. Farnatano said. If you take a look at the percentage of the population that's vaccinated, the actual risk of being hospitalized and being in the ICU, the relative risk that is much higher in unvaccinated individuals. So we're seeing the same trends.
And Dr. Baba from San Francisco.
Yeah, I'll just echo with what the other health officers have stated. In San Francisco, of our hospitalizations, the rates for fully vaccinated is a 9.3 out of 1,000 cases, whereas for the not fully vaccinated, it's 78.2 per 1,000 cases. So a huge difference in terms of vaccination status and what causes people to get hospitalized. Since the beginning of the pandemic, fully vaccinated patients have accounted for just about 0.5% of all COVID hospitalizations in San Francisco. So really a fraction of the hospitalizations. And we do know that vaccination really does help prevent severe disease and death.
So the next question from KQED Public Radio, is this essentially a ban on indoor dining? Who wants to take that one? Dr. Hernandez, can I maybe pick on you?
Absolutely. You were faster at the request than me at clicking my video. This is not a ban on indoor dining. In fact, these requirements are the same that we had when we had the requirements earlier in terms of being able to wear a mask indoors and then removing them when you're eating. So when you're actively eating, you can remove your mask and that will allow you to participate in indoor dining or other activities that would be that are indoors.
Dr. Farnatano.
I would like to also add that even though it's not addressed in this order, if you're unvaccinated, I would still strongly advise against higher risk indoor activities like eating in an indoor restaurant, going to exercise in a gym, or going to a movie theater where other people around you are removing their masks to eat or drink or have popcorn at the movie theater. Those are very high risk activities if you're unvaccinated, and we really encourage you to avoid those things, eat outdoors, exercise outdoors until you can get fully vaccinated.
Thank you. We have some more questions in the Q&A, but I'm gonna call on Kenny Choi, who has his hands up, not just one, but two. So I'm gonna pick one and see if that works. Kenny?
Sure. Can you guys hear me?
We can.
My question is about demand for testing. Demand for testing seems to be up. People are saying it's difficult to get appointments, walk-ins even harder, whether they have insurance or not. So can each county address if there is consideration to open up more testing sites or even those mass testing sites that we've seen in various counties?
Great question. Thank you so much. Dr. Farnetano, I'll start with you again if I can.
Yes, here in Contra Costa County, we have seen an increased demand for testing, and we are working with our local labs and have reopened up contracts with additional labs to make sure that we have the lab capacity to do this testing as well as the testing site capacity. So we're monitoring that carefully. We've already decided not to scale back some testing sites that we had considered scaling back. And as the demand changes, we are going to consider opening up additional testing sites or additional hours if we need to keep up with the testing demand.
Dr. Mace?
Yes, thank you. We are also doing the same. We're definitely seeing an increase in demand for testing. And we have been able to successfully get more support from the state with Optum Server LHI, and that should be starting soon. We also have Curative, who is increasing the amount of testing that they're doing. And we're trying to increase staffing in our testing team to try to address some of the issues that are coming up, be able to provide the support, especially for in the setting of an outbreak, that sort of thing. And we're talking to our laboratory, which is a regional lab, about going back to weekend staffing and running tests on the weekend so that we don't have a lag.
Dr. Baba, or Dr. Santora, I see you're there already.
In Marin County, we also are seeing an increase in the demand for testing. We're also fortunate we have partnerships with the state and with Curative to ensure access through to testing countywide. We've also been expanding a partnership with the state so local community-based organizations can have access to testing as well as our facilities. So having more MyMax and antigen tests available in the community at sites across the county is a top priority for us, and we'll continue to monitor access to determine if we need to ensure additional resources are made available to maintain testing capacity.
Thank you. Dr. Baba.
Yeah, we also are planning, are continuing our testing full speed ahead. We do see an increase in testing demand, and we have Alameda market open for the general public. We have concentrated our testing where we're seeing the most case rates and in places where people have difficulty accessing testing. So that includes the southeast sector of the city, as well as in some of our more vulnerable settings, such as our nursing homes, our shelters, and other congregate settings, and are also looking at utilizing Bionex much more fully moving forward.
Dr. Hernandez.
City of Berkeley is also seeing an increase in demand for testing, and we are working with our testing partners, which include the state as well as Curative, for the sites that we already have to expand the hours there and potentially days for individuals in our community to use those testing sites, as well as looking at other partners to do more community-based testing. So hopefully we'll have more on that, but definitely expanding the hours at our set sites, as well as encouraging individuals to seek testing with their medical providers if they have them.
Dr. Hahn.
In Santa Clara County, we've also seen a significant increase in demand of testing, and we have continued to maintain our mass testing sites and are increasing capacity. And you can go to secfreetest.org to find out how you can get a test. Thanks.
Dr. Moss.
We've seen an increase of about 50% in the total number of tests done per day. Demand is 3 to 5 times higher at some of our community test sites that we've continued to support really throughout. And so far we've been able to absorb that demand, but we'll continue to evaluate and make sure that people can get tested when they need it.
Why don't you leave your camera on, Dr. Moss, and I'll ask you to take this next question. With children under 12 unable to get vaccinated, why not ask schools to delay in-person instruction or offer more robust remote learning options?
Well, I think, first of all, we've all learned what a difficult year it was for children who, in many cases, were not able to get back into the classroom. Of course, the Bay Area health officers have previously strongly voiced our support to get students back into classrooms, and we do think that that remains a top priority, and it can be done safely if the right measures are in place, including face coverings, which are still required by the state for everyone in school settings. Of course, what we're doing here in Alameda County is continuing to support schools and districts to be as prepared as possible, and make sure that those prevention measures are implemented to keep kids in classrooms and keep them in classrooms safely.
Dr. Santora.
I would just add that our top priority last school year was getting kids back into in-person instruction. We saw the emotional and mental and social deterioration of many students because they were out of the classroom. And we learned so much last year of what we can do to create the safest environment possible. Marin County saw an uptick in cases when school ended. Schools offer a structured, supervised, supportive environment where children, teachers, and staff alike can wear masks, which are shown to be effective in both source control and preventing and personal protection. So that is our goal, is again to get kids in school and keep them in school. And that's where we need to work together as a community, not only to get vaccinated, ensuring that everyone who is eligible in a household gets vaccinated, but also to follow these requirements around masking so we can create the biggest cocoon we can around our vulnerable populations, which includes kids who are ineligible for vaccination and vulnerable more because they're going to be excluded from school if they even do get sick. So we have this tremendous opportunity ahead of us with this short-term strategy around masking to make sure we open all schools in the Bay Area and keep all kids in the Bay Area in school for in-person instruction. And then lastly, on the testing part, we're working, the state is offering tremendous resources around testing for the schools. So we've been working throughout the summer to pilot the availability of Binax or antigen testing in the school setting so we can support schools, especially some of the schools in our lowest income communities have modified quarantine. So this allows mass students who may have had a close contact with the case to have to be able to go to school in person. And that's because of what we all agree upon is that being in school is the best place for students to learn and to thrive.
So Dr. Santora, since I have you, maybe I'll start this next question with you. Should businesses require workers to get vaccinated?
We support businesses that require workers to get vaccinated. It's a hard decision probably for some sectors because of the percentage or proportion of their workers who are already readily vaccinated. What I experienced this weekend on call was a surge in cases of vaccinated folks who work in facilities, who are exposed in individuals in their households who are unvaccinated, and just with the Delta variant circulating. So especially with high risk facilities, having company supports for requiring vaccination is a critical tool for us. And I think you saw the indication from the state and some other counties around both vaccine verification and testing. But as more facilities require vaccination, we have more protections for our community.
Would anybody else on the panel like to address that one while I organize myself? Okay. So we mentioned that some county orders will differ slightly. I think, Dr. Hahn, I'm going to call on you to talk a little bit about what the differences are in Santa Clara County.
Yeah, we all have our little individual health officer orders, which do differ slightly. But I think the main message that everyone should take away is we are actually in broad agreement that everyone should be masking whenever they're indoors. And the reason for that is because the virus doesn't care where you are. If you're in an indoor space with other people who you don't live with, it will find a way to get you. And so it's really important to wear that mask. It is unfortunate that we have to do this at this point in the pandemic. None of us wanted to be here, but the virus has changed. And now we know that the virus can be transmitted by fully vaccinated people. And even though unvaccinated people are much better transmitters of the virus than fully vaccinated people, because of this fact, this new fact of the virus, it is important for everyone to mask indoors.
Great, thank you. Are there any other differences among the counties that are worth noting? Okay, this next question, I'm going to kind of combine two of them. Maybe Dr. Mace, if I can start with you. What does this mean for bars, restaurants, and entertainment venues and gyms? And how effective will all this be if capacity limits are no longer in place?
Yeah, thanks very much. What it would mean, since they're all indoor settings, and we've already spoken a little bit about restaurants, bars, that sort of thing, that the mask mandate will be in place for everyone, vaccinated or unvaccinated. However, when eating or drinking, obviously a person can't be wearing a mask. However, gyms, family entertainment centers, we would expect that as long as in family entertainment centers people aren't eating or drinking, they would be wearing their masks, and in gyms as well. And I think we've already seen that masks, any kind of facial covering, whether it's a cloth covering or it's a surgical grade mask, is quite effective in preventing spread of COVID-19. So I'm hoping that this will have a really positive impact in decreasing transmission, even without capacity limits in place.
And I have a question specific for you, so don't go away quite yet. Dr. Mace, what is the caution offered to communities like Oakmont, which is senior and where members may say they have high levels of vaccination?
You know, that's a really great question. What I would say is that we are seeing cases amongst fully vaccinated individuals, as I've mentioned. In fact, up to 20% of our cases in Sonoma County are now occurring in fully vaccinated individuals. And those are people who are being diagnosed as a result of being contacts, or they're symptomatic, that sort of thing. So actually, we don't know fully what percentage of fully vaccinated persons are getting COVID. So for those who live in Oakmont, which is definitely an older population, I would say be careful and don't take any risks. I would advise staying away from any gatherings, even if fully vaccinated, staying away from indoor settings where others may not be wearing masks, so say indoor dining, for example, and rather opting potentially for not going to a restaurant or being in outdoor dining situations. But take precautions, because we are seeing that people with underlying medical conditions and people who are older are the ones that are more affected right now, even if fully vaccinated.
Thank you. This next question, why was this decision made now and not 2 weeks ago? Was hospitalizations the main factor? We've been seeing these numbers go up for a while now. We're just curious, what was the main difference driving this decision? Who would like to take that one? Dr. Moss.
Well, yes, we've been seeing a rise in cases for several weeks, and we knew we had large numbers of unvaccinated community members who are at risk with certainly with a more transmissible variant like Delta. But what we learned, the evidence has really built, and what started to emerge, I would say, in the last week is that there is a higher risk of vaccinated people once they are infected, even if they're at lower risk of infection. Once they are infected, does seem like there's a higher risk of them passing it on than we saw with earlier variants. So that's really a change from what we had seen earlier on, and for that reason, the added layer of protection of masks on everybody in public settings becomes much more important.
Dr. Santora.
Being driven by the data, we county expected after the 4th of July.
We're having a strange sound issue for you. Do you want to mute yourself and unmute yourself again?
Is it strange still?
It is.
Well, I'll stop talking and I'll just add my comments in the chat.
Thank you. Thank you. And maybe if you want to go out and come back in again, we'll come back to you on that question. So the next question, is there a target for case rates that will end the new mask mandate? Dr. Farnetano, maybe I can come to you on this one.
I think even more important than case rates are really the hospitalization rates. We know that with vaccinated individuals, while they can get infected, most of the cases are mild or even asymptomatic, but it's the hospitalizations that we're really worried about. You know, people who are in the hospital with COVID, they're really sick. They're gasping for air. They're struggling to breathe. If they're in the ICU, they're likely have a tube down their throat on a machine breathing for them, fighting for their life. This is what we want to avoid. Even if you survive a COVID hospitalization, I wouldn't want to wish a COVID hospitalization on anyone. It's a terrible experience. And so we're really looking at, you know, the hospitalization rates as a key indicator now that we have a vaccine that can keep most people out of the hospital. If we can get our hospitalization rates down to where they were, you know, in mid-June, then we can start thinking about, you know, easing off on some of these restrictions.
Great, thank you. Dr. Santora, are you back? Do you want to give that other question one more try?
I still sound like Darth Vader. Nothing changed.
Yeah, you do still sound like Darth Vader. Sorry about that. So this next question, in previous surges, there was a clear correlation between the rise in infections and hospitalizations deaths. We aren't seeing the same mortality rates we saw last year or in the winter. Can the health officers comment on the current science around case rates and mortalities and what we're seeing in various counties around the Bay Area? Dr. Moss, do you want to start with that one, or?
Sure. So, you know, I think the most important thing is that, you know, when we in this summer surge, this current summer surge, is that the deaths can lag. It can take some time for us to see that, both because of the progression of illness for people who are sick. And then also it takes sometimes extra time for those deaths to get reported and captured in our surveillance systems. And so, you know, for that reason, I think it's important to withhold judgment until we've had enough time go by. Certainly so far, we have not seen large numbers of deaths tied to this this summer wave. We've seen some, and our hope is with our most vulnerable adults and our oldest adults, really at very high levels of vaccination, that we won't see as much risk of death as we saw previously. But again, I think it's important to really make sure that enough time has passed to fully assess what's happening.
Dr. Mace, did you want to add to that, and then we'll come to Dr. Farnetano.
Yes, thanks. I would agree completely with what Dr. Moss just said. I just want to also note, this is more data and evidence of the efficacy of vaccines. The fact that we're not seeing the worst outcomes is attributed to the fact that the vaccines work. And that's what the clinical trials showed, that people who are vaccinated may get COVID, but wouldn't be as ill and wouldn't have the outcomes. So it's another plea to the community of those who are not vaccinated yet to get vaccinated. It's more proof that vaccination works and is quite effective.
Dr. Farnetano.
Yeah, I would agree. And the death data is a lagging indicator. People often linger in the hospitals for several weeks before they die, and then we often don't get the death certificate data for some time after that. However, having said that, we are seeing nationwide deaths starting to go back up again, and even state data is showing an increase in the deaths from COVID, almost exclusively in the unvaccinated population. So I do expect, unfortunately, in the Bay Area, we will also see deaths going up and over the next month, again, mostly limited to the unvaccinated population.
So as a bit of a follow-up to that, Dr. Fratantano, if hospitalizations are mostly unvaccinated, how can the lower death rates be evidence of efficacy of vaccines?
If we look at the overall death rates, they are lower because so many of the Bay Area residents are vaccinated. So the large portion of the population is protected, but unfortunately, there's still a segment of the population who is not. Our seniors have really led the charge in getting vaccinated at very high rates, and those are the most vulnerable. So they have been very well protected. But unfortunately, we're seeing a shift in the age of hospitalizations and even deaths to younger age groups, people in their 40s and 50s and early 60s who have lower vaccination rates than our seniors.
Thank you. So let's talk a little bit about enforcement, which is, sort of the hardest piece of this in some ways. Are restaurants and bars expected to enforce the indoor mask mandate? There's another one about San Francisco talked about no real enforcement plan. What about others? Fines for businesses with unmasked people inside, tickets for people unmasked inside. Really questions about fining for businesses. I know that we're all hoping that we don't come to that, but how are your counties sort of addressing that topic? Who would like to start? Dr. Hernandez, we'll start with you.
Sure. So for the City of Berkeley, in our order, it is required that businesses have signage indicating that this is a requirement for patrons in their businesses and work sites in terms of masking indoors. So that's one thing that is specific to our order. I can't speak to the other jurisdictions, but that's one thing that we have in the city. We also spoke about our enforcement support that we've had in the past, and what we have done in the past and what we will continue to do is to support businesses by first through education and information in terms of the requirements of this order. And then we would work with them to be able to comply.
Dr. Hahn.
Yes, I do want to add that in Santa Clara County, businesses are obligated to enforce the mask mandate. And this is something that we've done in the past. And residents can submit complaints to our website. And that, the county will follow up on those as appropriate.
Dr. Mace.
Yes, thank you. Yeah, I would just say the same, that, we definitely hope that people are going to take this order seriously and protect themselves and their community. And we'll work closely with our employers, our businesses, to ensure that this occurs in all public indoor settings.
Well, Dr. Moss, go ahead.
Well, I was just going to add that, we know there are businesses that want to have people masked. They want to protect their workforce and protect their customers. And this is actually, I think, an added, this is something that they can point to and say, really it is, the county across the Bay Area, this is really a requirement now. And so I think it is actually going to be useful even in that respect.
And Dr. Moss, maybe you could talk a little bit about sort of the details of that. So diners are required to wear a mask when they enter the establishment, when they're not eating. What are the particulars of that?
Sure, and I can only speak for our order, but I know others have similar language, which is that people can remove their masks to eat and drink, and that's a reasonable exception. It's at those other times that people should be masked up, and yes, we do expect businesses to expect that of their customers, but in settings where there is no eating or drinking, and there isn't another reason for an exemption, everybody should have a face covering on.
Thank you. We have Martin Espinosa's had his hand up for a while. I did ask his question that was in the Q&A, but I'm going to unmute him and see if, his hand went away. Kenny, I see that you had a follow-up question to testing times. What are we hearing currently in terms of wait times to get appointments and difficulty in finding walk-in sites for testing? I'll just quickly say that in our county, we have a private testing site or two that has reported hour-long wait times, but we're not reporting those at our county sites. Is there anybody else that would like to talk about the wait times in order to get tested at their sites? All right, it sounds like that might be a detail we'll have to collect for you in another way. I think this is kind of a new and evolving situation. So let me see what we can find out. We'll get back to you on that, Kenny. So I think we've talked a little bit about herd immunity, but there's sort of another question about what numbers do we need to reach to get there. I think it's sort of worth kind of talking a little bit about, what herd immunity is and how difficult it is to sort of define. So I wonder if there's anybody, Dr. Farnatano, if you'd be willing to take that on.
Sure. I think last year there was great hopes that this virus we could with a highly effective vaccine achieve what some people call herd immunity, some people call community immunity, and there were some predictions that maybe if we got 70 or 80% of the total population, vaccinated, that would be sufficient. Unfortunately, what the Delta virus has taught us is that those levels are far from sufficient, and that we have communities that have vaccination rates that well exceed that, and yet the virus is spreading and spreading rapidly. It's really unclear whether there's any level that will really extinguish community transmission. What really we're hoping for with the vaccines now is to protect people from severe illness and keep the rates at a low level and the symptoms to be minimal or mild. But the hope that we'd be able to achieve kind of herd community immunity, especially when we have a big segment of our population, kids under 12 years old, who can't get vaccinated, is unfortunately not really feasible at this point.
Okay, we are at 12:59. So there are some questions we didn't get to. So if you have lingering follow-up questions, please feel free to reach out to the county that you think that question applies to most offline. Dr. Han, do you want to quickly talk about your media availability later this afternoon?
Just that it's at 2:30 and the invitation has been sent. Thank you.
Okay, great. So I want to thank our panelists for being with us today, and I also would like to thank Michael McMahon, who is our ASL interpreter, for that important service that he gave. We're going to stay around for a couple of minutes, and thanks to Santa Clara County, we have a couple of interpreters who are going to do sort of a recap of this in 4 different languages. So thank you, doctors. Feel free to drop off, and we will do the recordings of these other languages. And then we dropped in the chat the link to our YouTube channel, where momentarily, when we finish the other languages, this video will be posted for your downloading and editing.
For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.